Okay, may I invite Dr. Itzkowitz to the podium to present a case control comparison of laparoscopic and open approach for the surgical management of small bowel obstruction.
Ladies and gentlemen, Mr. Chairman, we have no disclosures. Laparoscopy surgery for small bowel obstruction, SBO, can be challenging due to the dilated and fragile bowel loops, dense adhesions, and inadequate operative space. Potential advantages of laparoscopic surgery compared with an open approach are reduced pain, earlier recovery, reduced pre-operative morbidity, and better cosmetic. Laparoscopy may reduce intra-abdominal adhesions formation and hence recurrent SBOs. Also, laparoscopy may decrease wound complication, including wound infection, dehiscence, and incisional hernias. Studies from the last two decades demonstrated that laparoscopy in the setting of acute SBO is feasible and safe. However, in these reports, conversion to a laparotomy incision is common, usually around 20 to 30%, and there are concerns for increased morbidity. In addition, comparative data on short and long-term results of laparoscopy and open approaches for SBO are limited. The objectives of our study were to identify the risk factor for conversion and investigate its consequences, to compare short-term outcomes of laparoscopic and open surgery for small bowel obstruction, and to compare long-term rates of readmission and reoperation for recurrent SBO and incisional hernias. We retrospectively identified all patients operated by either laparoscopy or laparotomy for a pre-operative diagnosis of SBO during a 10-year period. Clinical data were collected from medical charts. Long-term follow-up data were completed using a telephone survey. Converted and non-converted patients in the laparoscopic group were compared for preoperative characteristics and short-term outcomes. Patients in the laparoscopic and open groups were matched for age and extent of previous abdominal operations for comparison analysis of short and long-term outcomes. Data were analyzed according to intention to treat for the converted laparoscopic patient. This slide describes the grouping method that we use to match patients according to the extent of previous operations, from group 1 that include patients who had no previous abdominal surgeries to group 4 where patients had multiple laparotomies. Results. The laparoscopy group cohort included 91 patients, 29 of them were converted. Converted and those who were completed laparoscopically had comparable demographics, comorbidity profile, and extent of previous operations. All other preoperative clinical parameters not shown in this table and intraoperative findings were comparable. Surgery in converted patients lasted significantly longer. These patients experienced slower intestinal recovery and higher overall and surgical complication rates. As a result, they stay longer in the hospital. The matched laparoscopic and open cases included 71 patients in each group. They had similar demographics, comorbidity profile, and other preoperative clinical parameters. Laparoscopic cases had higher rates of extensive adhesions as opposed to single band adhesions compared with the open group in our study. Operative complication rates were similar. Laparoscopic patient had earlier bowel recovery compared with open patient and slower overall morbidity. Despite shorter median length of stay in the laparoscopic group, this difference was not statistically significant due to a wider range in the laparoscopic group. The 30 days readmission, reoperation, and mortality rates were similar. And now for the long-term results. This slide shows the Kaplan-Meier curve of readmission for SBO with time. Laparoscopic patients tended to have lower readmission rates for recurrent SBO, but this difference was not statistically significant. Rates of reoperation for small bowel obstruction in the laparoscopic and open groups were similar. 1 patient in the laparoscopic group and 3 patients in the open group have developed incisional hernia. This difference was not statistically significant. I will skip the limitation because of the time. To summarize, laparoscopy offers shorter bowel recovery and reduced morbidity. Conversion is relatively common, 32% in our study, associated with increased morbidity, and it is difficult to predict. Laparoscopy may reduce long-term readmission rate for recurrent SBO, but not necessarily affect reoperation and incisional hernia. We concluded that laparoscopy can be offered to a higher percentage of patients with acute small bowel obstruction. A low threshold for conversion to laparotomy may be required. Further research is required to better select the surgical approach for individual patients, and longer follow-up may clarify the long-term benefits of laparoscopy.